All right. So we're moving to the next route of drug administration, and this is what is known as the vaginal route of drug administration. Okay. So for the vaginal route of drug administration, you can say vaginal route or intravaginal. So you just have to do it. You are giving drugs right into the vagina. Okay, you are giving drugs right into the vagina. So there are different types of drugs that can be given into the vagina. It can be gels, okay, it can be tablets, it can be vaginal ring, all those oral, all those contraceptives, it can be suppositories and the rest. So it just involves delivering medications directly into the vagina. So sometimes it could be that, or most at times, it's just to treat some women-related issues, So gynecological issues, reproductive conditions, So it's used for what? To treat conditions locally in the vagina, or you want to use that route to actually deliver drug right into the system, So examples of drugs that can be given into the vagina can be contraceptives or hormone therapy. A woman doesn't have some hormonal balance, so you want to actually balance that. Sometimes can be due to infections, So antimicrobial treatments. Antimicrobials are into what? Antivirals, antibiotics, antifungals, So advantages is if you actually have a vaginal problem, there's no point sending the medication into the whole system, You can just give it directly into the vagina. So it targets vaginal infections, hormonal imbalance, and if there's a need for contraception, of course, this can actually serve that. So because you are not putting it into the system, you are just putting the drug right there, So there's reduced risks of what? All those adverse effects of drugs. So you are not also putting it through the mouth. It's not coming through the liver. So you are bypassing the first pass effect. It's non-invasive, and if you teach the patients, they can do it by themselves. Okay. There's sustained drug release. If they are putting a suppository there, it now stays there and allows for what? Timely release of the drug components. So disadvantages is you can't really use the vaginal routes to treat a lot of conditions. It's just mainly what? Conditions locally limited to it, So there's variable drug absorption. So many things actually affect how a drug will be absorbed when you place it in the vagina. Alright, and sometimes can actually irritate the vaginal area, and imagine the drug burst out, So the components can leak and can inflame in the place. The slow onset of action compared to what? Intravenous administration.